Good morning, team. I want to take a few minutes this morning to answer questions that we've been hearing from so many team members and participants. These are 6 questions that seem to be coming up over and over again. So hopefully this will help you understand where we are as an organization and how we are responding to the current phase of transition within the context of COVID-19. So the first question is this. I've read that several hospitals will be mandating COVID vaccinations for their employees, volunteers, and students. Will Life Circles be mandating the vaccination? I'm going to start by answering in this way. On July 26th, more than 50 healthcare professional societies and organizations called for all healthcare employers to require their employees to be vaccinated against COVID-19 in a joint statement. These societies and organizations represent millions of workers throughout health and long-term care, from doctors and physicians' assistants to nurses and pharmacists, from public health workers and epidemiologists to long-term care, home care, and hospice workers. Groups include the American Medical Association, American Nurses Association, American Academy of Pediatrics, American Association of Medical Colleges, National Association for Home Care and Hospice, and Leading Age. Most major health systems in our communities have already issued public statements that they will be requiring their workforce to be vaccinated. This includes Trinity Health, Spectrum Health, Ascension Health, U of M Medical System, and Metro Health, as well as the federal government and some other systems. Some organizations are waiting for the vaccinations to move from FDA emergency use authorization to FDA approval. FDA approval is expected by this fall. Attached to this email, I've included some information about how the difference between FDA emergency use authorization and FDA approval. And I've also included the joint statement from the 50 associations that I referenced. So what's Life Circles doing? We are working with guidance from UMRC in Porter Hills and other long-term care and community-based entities to determine if we will be mandating vaccinations. Life Circles, as with all other healthcare and non-healthcare employers, is grappling with the details of such a mandate. Our number one priority is the safety of our colleagues and our participants and their families, as well as all community members. We will be sure to communicate any changes in our vaccine recommendations as quickly as we can and as we move through this process. What is the plan for remote work versus on-site work? Every industry has been forever impacted by the COVID pandemic, and many lessons learned from being forced to work remotely and use technology more effectively and re-examine traditional workplace expectations will evolve as a result. This means that certain employees, based on their role and function, will remain remote workers. Other jobs require team members to be back in the day center all the time. And still others will be more of a hybrid role, where they work remotely sometimes and they're in the day center other times. Decisions on where and how work needs to be performed is based on purpose and function, which includes productivity and efficiency. In preparing to respond to this question, I thought through some of the huge changes that we've made prior to the pandemic and during the pandemic. And one is in the area of software. We now have specific software that allows us for real-time virtual access to almost everything we need to run our organization. So we have TrueChart for our medical record. We have Concur for all of our invoicing and financial approvals. Our policies and procedures are in Power DMS. HR and payroll is handled through ADP. We have a contract software called Contract Folder, and the ability to approve contracts using Adobe Signature and DocuSign. Referrals and intakes and in the enrollment workflow is handled through a system called Inquire. The board of directors have their own portal called BoardPack, where we're able to upload the documents needed for board meetings. All of the Medicaid correspondence, so the way in which we help people apply for and get approved through Medicaid, is done electronically. All of the equipment and supplies we do electronically through StateServe and Medline. Even our training is done through MyLearningPoint. And now we can even do the daily health screens through Health Champion. So all of this technology has led to great efficiencies and created much needed flexibility for where and how we work. Now, all of that being said, I recognize the value of human connection. It cannot be underestimated. And I also understand that the Life Circles care model must prioritize in-person relationships with participants and each other. The power of in-person IDT meetings cannot be understated, nor can the value of human touch with frail older adults. However, we also recognize that COVID is not over. The pandemic is not yet fully behind us. Minimizing frequent close contact with others remains strongly recommended by the CDC, especially for healthcare providers and those who frequently interact with vulnerable people. Therefore, we are intentionally and deliberately working on what we need to look like now and when we are past the pandemic. The way we operate in the future will not be the same as how we functioned before March of 2020. Why is the Delta variant being talked about so much? The simple answer is this: because it's far more contagious. It's twice as transmissible as the original virus. It was first identified in December 2020, and within a matter of months had spread to 98 countries around the world. Currently, right here in the US, 83% of reported cases are of the Delta variant. Scientists are still analyzing data to see if the Delta variant is more dangerous, but many say it is. And what is clear is that the majority of hospitalizations and COVID-19 associated deaths in the US are currently occurring in unvaccinated people. This led to a chilling warning from the CDC director, Dr. Rochelle Walensky, that this is becoming the pandemic of the unvaccinated. Why is the CDC advising vaccinated people to wear masks indoors again? So let me preface my answer with this. You know I'm not a physician, nor am I a scientist. And I was very confused when I read about this guidance. However, I had an aha moment earlier this week, and now I understand why so many smart people are saying we should wear masks when we're indoors, even when we're vaccinated. So here's how I understand it. So vaccinated people have protective immunity from contracting COVID-19. Like all other vaccines, this is not 100%. However, vaccinated people are unlikely to have severe symptoms or need to be hospitalized from COVID-19. Vaccines are also effective against variants in COVID. The Delta variant is not the original COVID-19 virus, as I've already explained. It's a different strain that evolved from the original virus, and it's far more contagious. So, vaccinated people who catch the Delta variant may have minor symptoms or no symptoms at all. That means the vaccination is working like it's supposed to. However, their ability to spread the virus to others is the same as unvaccinated people who get the Delta variant. This is why infectious disease experts and the CDC want everyone to mask up indoors again. Stopping the spread will also decrease new, more serious variants from evolving. So if you are like me and wanting to get past this pandemic, you will need to do everything possible to prevent the further spread. Why are more participants coming back to the day center 5 days a week, but we still have team members working from home some days? Well, our goal is really to have enough staff on site to properly care for participants. And unfortunately, the community positivity rate is again on the rise. So we have to balance on-site expectations of specific team members with ongoing pandemic guidelines and recommendations. It's pretty complicated and it's a moving target. So we are tracking the implications of the Delta variant, the level of community spread, outbreaks, vaccination rates, hospitalizations, and deaths to guide our operations and our planning. There are some differences between the Holland and Muskegon facilities and programming, so please keep in communication with Kelly and Katie as it pertains to your specific role and specific site. Will the day centers close again? We do not plan to close the day centers or cease day center attendance as we have done in the past. Our hope is that the vaccination rates increase and that new variants don't continue to evolve. We know so much more about how the virus spreads than we did a year ago, and the treatment options are also becoming much better. So the goal is to continue operating the day centers. But please understand, we may need to institute additional cleaning, safety, or infection control practices, and we will have to adjust capacity limits based on outbreaks or other risks that are unknown to us at this time. So I've attached a few materials to my email this morning, and many of you are asking for more information, so please look it over and let us know if you have additional questions. The attachments include the joint statement of support of COVID-19 vaccine mandates for all workers in health and long-term care, an informational piece on the difference between FDA emergency use authorization and FDA approval, and a memo sent from NPA regarding a Health Alert Network health advisory. I appreciate each and every one of you. I hope you have a great weekend. Thanks